Good evening, everyone. Today's discussion will be about ankylosing spondylitis. I am Dr. Patterson, and I'll be discussing this with you all today. Now, ankylosing spondylitis is a form of arthritis. If many of you are unaware, arthritis is inflammation in one or more joints that cause pain and stiffness. Arthritis can worsen by age and has many different causes. Now, today we're going to get deep into it. So, focusing in on ankylosing spondylitis, this form of arthritis causes inflammation that affects the spine and larger joints. Now, while it has been seen mostly in men, it has lately been making its appearance in women. Ankylosing can cause the vertebrae to fuse together, causing severe pain and stiffness in each individual. Studies show that it's extremely hard to pinpoint one extreme cause of ankylosing spondylitis, but it has been stated that due to it being an autoimmune disease, it is caused by a fault in the immune system that causes its own body to attack the tissue. Now, we have seen several researchers linking ankylosing spondylitis to the gene HLA-B27, which is a part of the genetics. HLA-B27 is a human loci antigen. HLA-B27 provides instructions for making protein on the surface of white blood cells. HLA-B27 helps the immune system distinguish between your body cells and human pathogens in the body. That's crazy. Now imagine this. If that gene is damaged, it causes damages to your cells, right? It's crazy. Now, this damage won't be able to distinguish your own cells from harmful pathogens. So think about the infections and diseases that your body does not have the ability to fight off if this gene is damaged. It's crazy. Now, researchers have noted that ankylosing spondylitis is linked to the gene, which is hereditary, meaning one or both of the parents carry this gene and have passed it along to their offsprings. When HLA-B27 is present, it puts the individual with this gene at a greater risk for developing and having specific autoimmune disorders. Wow. To give you all some back information on autoimmune disorders, it is a condition that occurs when the autoimmune system mistakenly attacks and destroys the body's healthy tissue. And this is exactly what ankylosing spondylitis does. Remember, it's attacking its own tissue in those joints. Now, let's take a look at some of the symptoms that we mentioned in ankylosing spondylitis. The symptoms of ankylosing spondylitis are stiffness in the spine with severe inflammation in the large joints such as hips, back, shoulders, and neck. This stiffness can reduce one's ability and flexibility. Now imagine not being able to touch your toes or bending down to pick up a penny due to this stiffness. It's so severe you might not even be able to pick up your children. A great example of the posture that ankylosing spondylitis can cause is the Hunchback of Notre Dame. Now, as a kid, many of us have watched the movie and we always wondered why his back looked like this. Now, it's not proven, but he could have a form of arthritis, specifically ankylosing spondylitis. I have a client whose back is beginning to look like this. Now, let's go a little bit further. The hunch forward posture can increase headaches, increase neck pains, cause pinched nerves, disc herniation, and a decline in muscle strength. This pain is extremely severe. Now, these symptoms mentioned can develop gradually over time within days, weeks, or even months, and they can worsen with time as well. Now, I have a patient who says her symptoms worsen at night, especially after a long day of walking or even playing with her children. So she's already struggling with being able to bend down to grab her children, but even sitting down or running around to play with them causes her a little bit of pain over time. Now, it says that researchers have noted that it can be more prominent in the morning as well. So after laying down and not really doing movement in your sleep, just imagine waking up to stretch and you're in severe, severe pain. Now, if you're sitting behind a desk all day, not taking a moment to stretch or even walk around to use the bathroom, the body is completely stiff. This is reducing flexibility and causing severe pain when trying to move. That's why it's super important to get up while you're working and walk around. If this individual was to get up and lightly stretch or take a walk, maybe to the bathroom, this would lessen the pain and stiffness in their body because the joints would be moving. They would be getting some type of action. A research case study showed that patients can feel this intense pain at random and regular periods during the day or night. So it doesn't matter when. Somebody right now could be sitting right here in this room as we're discussing this and feel the pain out of nowhere. Ankylosing can affect individuals one or both sides of the body. It's not specific to which side it attacks. So this autoimmune disorder can attack from each side. It can be your left side and your hand that leads this shocking pain to your neck. Who knows where it's coming or when it's coming? So let's get deeper into the symptoms. It can reduce mobility, cause pain and swelling, and it can be seen in areas like the neck and lower back. This is causing the vertebrae to fuse and experience muscle loss. With muscle loss, it can cause pressure on the ankle and knees. So now it's just causing pain everywhere. Now let's talk about how this pressure can reduce the ability to walk, causing these individuals to limp or wobble. Not only do they have a hunch forward posture, but now they're walking with a limp or wobble. It's so sad. Now I don't want us to get stuck on the physicality of ankylosing spondylitis. Let's talk a little bit about the mental and chemical as well. This disorder can cause severe hormone imbalance that can result in anxiety and depression, as well as ruin one's self-confidence if they do not like the outcome of their posture. Now, many have seen The Hunchback of Notre Dame, and they've seen how this posture made him unattractive, and many joked and bullied him, stating that women would not like him. This could do this to people in real life. While ankylosing has been noted to affect women, let's go into women who are pregnant and dealing with this. Not only can they feel the pressure of their child, but this can make their pain more severe. My patient was pregnant and didn't have the opportunity to get an epidural due to this condition. Her doctor said that it was unsafe and could cause her to be paralyzed. Now, while getting the epidural is already scary, just imagine you really need it because you're in severe pain, and now you don't even have the opportunity to get it because your spine may be fused together, or the doctors can't even get you in the right position to get this epidural in. It's sad. Now, while her ankylosing spondylitis was very active during her pregnancy, some do have the opportunity for theirs to go into remission. Now, there are treatments for this condition. Some of these injections as well as medications through IV can be given to patients or even taken by mouth. I have a patient who goes to get her treatment every Monday, Wednesday, and Thursday. Now, she gets the Remicade infusion. She gets it done through IV. And in the photo seen, you can see that it's an IV in her arm. Now, if some people do prefer to take medication like Motrin or ibuprofen, and this can help with the pain. But after taking these medications for a long period of time, the body gets used to the drug and the effect of them will no longer work, causing these individuals to resort to the Remicade infusion or Cimzia injection. Now we all know, imagine constantly taking Motrin and ibuprofen, and your body is getting so used to this medicine that it no longer works. So now you have to resort to other options. Now, while there are several medication options, if these medications and infusions do not work, the doctors give the option of a TNF blocker. Now, a TNF blocker is a tumor necrosis blocker. These blockers are used to suppress the immune system by blocking the activity of TNF, which is a substance in the body that can cause inflammation and lead to immune system diseases. Wow. Now, it's stated if you have any tuberculosis or anything that this could cause an infection. So it's good to talk to your doctor about this. Now, at the rate that none of these options or the blockers are working or relieving any pain in these individuals, surgery is an option, but this is only for severe cases where the joints are completely damaged and severely needed to be replaced. So if no medication, no injections, no infusion, and the TNF blockers are no longer working and your body is beginning to wear on these joints, it is time for surgery. Now, in order to prevent ankylosing spondylitis from causing severe pain and swelling, individuals should practice good posture, reducing and eliminating smoking from their habits. Staying active helps exercise and ease the pain, as well as help these individuals maintain flexibility and improve their posture. When their posture begins to improve, it helps reduce a hunch posture and will allow them to gain more self-confidence. So if you're stretching and you're walking and you're working your joints out, it releases some of this pain and builds one's confidence because they might not get a hunch forward posture as early. Now, yoga is a form of staying active for an individual with ankylosing spondylitis. Yoga will help these individuals improve spinal flexibility. Remember in the beginning, we talked about lacking the ability to bend down and pick up objects? Yoga can help them regain this ability. Not only can it help with flexibility, but it can help with pain management and meditation and mindfulness. This will help build physical well-being all over. All right, now let's wrap this up. Today we learned that ankylosing spondylitis did not have a major cause, but it can be linked to the HLA-B27 gene, which is hereditary. This disorder can cause stiffness and reduce flexibility. The inflammation affects large joints and the neck and spine area. Treatments include, but are not limited to, oral medications, IVs, and injections. And in severe cases, surgery is recommended. Yoga and staying active can reduce the severity of this disorder. All right. Any questions for me? Yes, I have a question. Is Remicade only in an infusion? Well, thank you for asking. Yes, Remicade can only be done through IV. You can get the Simpania Aria as an injection or the Cimzia as an injection. Anything else can be an oral medication like ibuprofen and Motrin. It was great talking to you guys today, and we'll see you another time. Good evening, everyone. Today's discussion will be about ankylosing spondylitis. I am Dr. Patterson, and I'll be discussing this with you all today. Now, ankylosing spondylitis is a form of arthritis. If many of you are unaware, arthritis